Global partners are working with Nigeria to strengthen its health system. At the forefront of this effort is the Bill and Melinda Gates Foundation, acting as a strategic ally in tackling the country's most urgent health challenges, while the foundation tracks progress in critical areas, especially routine immunization. Vaccines remain a top priority because every naira spent on immunization really pays off. Research shows that investing in vaccines delivers returns many times over by preventing disease outbreaks, reducing hospital visits, and keeping children healthy and productive through childhood and beyond. Another central focus is empowering women. When mothers have access to antenatal care, autonomy over health decisions, and support from community networks, their children are much more likely to receive all needed vaccinations. But despite national gains, big gaps remain. Immunization coverage continues to vary sharply across regions in many parts of the Northeast and rural areas. Routine vaccination rates lag behind urban centers and the Southwest. Closing these geographic inequities is essential if Nigeria is to achieve universal health coverage. While looking back at 2025, the foundation reflects on what has worked and where there's room to improve. The progress in expanding primary health care access, boosting public trust in health facilities, and expanding immunization reach provides a solid foundation. But persistent funding gaps, regional disparities, and challenges in sustaining gains point to the need for renewed commitment and smarter strategies in the months ahead. Bill and Melinda Gates Foundation Chief Executive in Nigeria, Uche Amaonwu, joins us now for a conversation around this. Good afternoon. Thank you so much for joining us on Newsday.
Good afternoon, Cynthia. It's good to be here.
Well, let us start with the Foundation's 3 aspirations. How does this align with the Nigerian development priorities, and is anything changing in the country-level objectives?
No, thank you for that question. So the foundation has 3 aspirations, as you rightly pointed out. The first 2 are linked to the work we do around health. And even as I listened to your introduction, you start talking about some of that work implicitly, right? The first one is to make sure that no woman, child, or baby dies of a preventable cause. And the second one is to eradicate all infectious diseases, right? And we have about 20 years to be able to make these aspirations happen. The third one is not related to health. It's around providing economic opportunity to lift millions out of poverty. But if we stick to the first 2, which is around essentially child and maternal survival, it's always good to start with a positive view of what the numbers tell us. So over the past 25 years, we've actually cut the number of child deaths by about half, down from 10 million to about 5 million. And when you think about maternal death, it's actually cut down by about 40%. So this is all good progress that Nigeria has been part of. But what the data also tells us is that today, Nigeria still has some of the highest maternal mortality and child mortality rates in the world. And, because of this type of data, that's why in 2023, when we engaged with the new administration that just came into power, they were interested in prioritizing interventions that are actually going to drive declines in these difficult rates. And it was easy for us and a lot of development partners to fall behind that cause because we know this is the right thing for Nigeria to be able to do. So as early as 2023, even before we talked about these aspirations, we're already backing efforts by this administration to be able to align itself against a clear set of priorities, start coordinating resources from all development partners and all stakeholders, both at the state and federal level, towards those priorities, and measuring results on a regular basis, right? So we've always aligned our work around those 2 areas, focused on maternal and child death. So in that sense, the new aspirations haven't changed our objectives, right? If anything, I think the benefit of a timeline is that it creates a heightened sense of urgency, right? And a very clear focus on what we want to achieve over the next 20 years, which is essentially the timeline that the foundation has to be able to drive these aspirations before we finally close our doors. So nothing has really changed from what we had before, but we do feel a greater sense of urgency to be able to make those results real for Nigerians as quickly as we can.
Fantastic, and we must applaud you for the progress you've made in bringing down those numbers when it comes to maternal and child death. Now, but we understand that there was a recent intervention to close the gap when it comes to routine immunization coverage and the rise of zero-dose children during the October integrated campaign. Now, how would you describe the intervention and outcomes regarding that?
So I think linked to the two priorities I talked about, right? No women or children dying of a preventable cause and infectious diseases. The October campaigns were actually a bit historic from Nigeria's perspective, right? It was the first time that Nigeria decided to have what they call integrated campaigns. Historically, we've always approached our campaigns around routine immunization in a fragmented way, right? So we do measles campaigns, we do it separately from polio campaigns, we do it separately from campaigns to go distribute bed nets for malaria and things like that. But for the first time, Nigeria decided that if we are actually going to make progress against these multiple disease areas, let's try our best to be able to integrate as much of our campaign work as possible. Because remember, this is all happening in a time where funding for global development is actually declining, right? The US government and others are reducing their giving to Nigeria. So I think it was the right call for Nigeria to be able to integrate. But then that integration is actually what made it difficult, because all of a sudden you had a large cohort of children that are being targeted. I think the number was about 106 million children. And you're trying to target those children essentially over 2 months, right? So it's a huge production that actually happened. But I'm glad to report that, it was largely successful, right? Nigeria was able to really combine polio immunization drives with the introduction of the measles and rubella vaccine with the, and we're able to combine it with some mass drug administration activities around some neglected tropical diseases. And also even use those integrated campaigns to be able to do catch-up immunization for girls who were missed as part of the last HPV campaign that happened earlier in the year. 21 states in the north were up in round one, and total number of kids that were targeted in that round one were about 60 million kids, right, in the north, and that happened in October. In terms of the coverages that we achieved, we're actually pretty impressed, right? So for for measles, rubella, the goal was to get about I think the number was about 37 million children, and we're able to hit 90% of that target, right? Likewise for polio, the target was to reach about 17.5 million, and we're able to hit that number almost at 100%. So it wasn't without challenges, but I think, this effort shows us that when we put our minds together and we can actually be able to have campaigns that are able to hit multiple things at the same time, which, as I said at the beginning, it's critical that we start thinking like that in Nigeria, because that way we are not fragmenting our resources, right? And we are using every single campaign to reach as much children as we want. And why are this important? Because you said it at the beginning, right? Campaigns continue to represent the most cost-effective way of reducing child deaths, right? Remember, we talked about the numbers of child deaths, where we're now trying to get from 5 million to about half of that in the next 20 years. But the most cost-effective way to do that is through campaigns and routine immunization, because a lot of the diseases that kill children are actually things that can be prevented with vaccines. So I think, for me, this is a proof that Nigeria can actually be bold, right, in how it does its campaigns. What Nigeria needs to focus on, though, after this is to say, can we actually have a way to routinize this type of results? Because campaigns are good, but they are meant to be one-off things to either introduce a new vaccine or to be able to have like an outbreak response. where Nigeria needs to get to is through its regular routine immunization systems, where when kids are born, they're given their vaccination cards of when to come for their vaccines, and they follow up doing that almost as a voluntary level. And the reason why this is the gold standard to get to is because then you don't need a large mobilization effort to be able to catch up and improve our immunization coverage. It's something that you can essentially do as part of regular visits to the clinic, based on your age cohort and things like that. So while the campaigns were effective, and we should continue doing more of that, I think the next thing we should aspire to as a nation is to say, how do we routinize this type of behavior so mothers know when they have to be able to bring their kids to get immunized, and they follow up as and when required.
So based on that, what would you say, looking back at 2025, what would you say are the big wins and disappointments for the foundation, and what is the outlook for 2026?
Yeah, so I think a couple of wins, right? Because you always have to celebrate even the small wins, right? I talked about one of them with the discussion we just had about campaigns. That was a big one, right? I think, introducing HPV vaccine that was able to reach about 12.5 million girls. Now also introducing the measles and rubella vaccine, the first time in Nigeria, and achieving almost 100% coverage. So these are all positive things. Beyond immunization, the country actually set out on an ambitious initiative to try and crash the high rates of maternal mortality in Nigeria. There's a program that has been launched called the MAMI program, which essentially tried to identify which local government areas in Nigeria constitute the highest rate of maternal deaths, and very intentionally target facilities in each of those local government areas with the right interventions to be able to prevent women from dying, try to convince governors to hire the appropriate number of midwives to be able to provide those interventions, to train those midwives and actually make sure that they are working in a facility that is well equipped and everything, right? So I'd say 2025 was largely successful in being able to pave the ground for all those things, right? We did see a record number of facilities that were rehabilitated or renovated. We've seen a sharp increase in the number of midwives that are hired. We've even seen some of these products that you use to address maternal birth complications for women start to turn up in the facilities. So I'd say the progress there was saying we actually have built the foundation so that when women now turn up to deliver, they actually have the services and the products to make sure that they deliver safely. So 2026 is going to be focused on making sure we can build on those foundations to intentionally improve the quality of care in these facilities that are now well equipped and have the right number of health workers to make sure that we actually realize those service outcomes of women not dying, right? So, investments in 2025, but now we actually have to make those investments work in 2026. So that's another piece I'll talk about there. We haven't talked about one of another areas where I feel like we've been able to do a lot of good work, which is around the non-health work, right? So, remember when this administration came in, there was a huge food crisis, right? And there was a lot of questions about nutrition and people being malnourished in a lot of our areas. So I think since then, we've seen the government really try to start focusing on, not only how to address the short-term crisis around food insecurity, but more intentionally start to think about how do we grow the economy, get people in more productive economic activity so that they're able to earn enough money to be able to feed themselves, take their children out of school. And, the government has done a lot of this through, stabilization of the exchange rate and other macroeconomic reforms. But that's now putting them on a path where there's now stability, right? You can actually now have smallholder farmers think about how to increase their production. You can have people that are starting business have a more stable environment to be able to take loans to be able to expand their businesses, knowing that there's a stable environment around there. Now, why am I calling those pieces, right? Because the interventions I talked about initially around specific things that target women dying and children dying are very essential things to do. But the data and evidence actually shows that if you're able to increase the economic livelihood of, families today that are not included in the financial system, low-income families, women as part of that family, if you're able to help them up the economic livelihood, then that actually translates to better care-seeking behavior. They're more likely to be able to bring their kids to receive their vaccines, right? They're more likely to be able to tell their kids to stay in school till they graduate secondary school. And each of these decisions actually has a large impact in producing health outcomes for the country. So I think both things are true. While you try and target the diseases as you see them, it's also important that we try to grow the economy and make sure that we have households that have good livelihoods, because I think both things happening together is what we need to be able to get to these ambitious goals we have over the next 20 years.
Fantastic. Great connection you made there between the link to care-seeking behavior and financial empowerment of the mothers. Now, the foundation has been a major advocate for polio eradication. Looking ahead, what's the long-term strategy for ensuring the established vaccine delivery infrastructure and surveillance network is fully and sustainably integrated when you look at Nigeria's domestic routine immunization system, as opposed to what might be the case when it's fading due to funding changes? Absolutely. No, it's a really good one.
It's very important that, and we talked about campaigns earlier on, right? I think, the work around polio eradication really has to be done through campaigns, because that work requires you to go find pockets of kids who haven't been immunized and actually make sure they are immunized, right? So there's a lot of work around surveillance. Where are the populations? Which of them have actually received the vaccine? Which ones haven't? There's a lot of, and that's, surveillance systems are things that can actually be repurposed, right? To surveil other diseases, right? Beyond polio, right? You could use it to surveil things like Ebola and other pieces of there, right? So the idea is that, I know there's a lot of data systems that are built into places to be able to enumerate where people are and how to reach them. There's investments in cold chain infrastructure to be able to store vaccines for polio and things like that. So the advantage of having such an intentional eradication focus, and by the way, Nigeria went through this with the wild polio virus, and we're very successful in overcoming it, is that you end up with a lot of assets that actually have reusability, right, for other routine things. So I think for us, as we try to now, mop up the last vestiges of the circulating polio variant that is still there, our focus is to intentionally work with government to say, how do we actually start doing three things? One, responsibly figure out how to transition these systems and the maintenance of these systems into the budgets of state and federal government. Because these are large systems today that are largely donor funded, it will require time for governments to be able to, put down the right budgets to be able to absorb them within their system. So we don't want to wait till eradication is done. We actually want to start phasing in that transition today. The second thing is really, really protect the surveillance network that we put in place. Because, the next time measles pops up, or yellow fever, diphtheria, or other vaccine-preventable diseases, having this surveillance system be able to work for those is going to be very critical. We all know with the stories we had around Ebola and, COVID, and how a few people were able to catch it at early. So that is the power of surveillance systems, and we need to make sure that work continues. The third piece is some of those routine equipment that end up in hospitals, like fridges where you put the vaccines, right? The vaccinators themselves, who've become very experienced in actually finding children and immunizing them. How do we make sure that those vaccinators are available to be able to support immunization drives routinely, right? There are community structures that have been built in the communities where you try to mobilize people to bring their families out to have those vaccinations. Preserving some of those structures is also going to be important in the fabric of the community. So I think those three areas, right, around the, transitioning maintenance of the system to government, looking at the surveillance networks and preserving it, and actually looking at those last mile last mile equipment that exists either at the facilities or the communities, and make sure that those are still there and can be activated is where the focus needs to be. So our strategy is to work with government, with local government, with the health sector, with the CSOs in the community to see how these things can be integrated into the fabric of those systems. The good thing is we still have about 2 years before we can get to that point, but that's 2 years to intentionally plan for doing this right. And we're excited at being able to work with Nigeria on that.
So as we wrap up, I'd just like you to talk to us about how you've been able to negotiate access in conflict-affected states, deal with geographical barriers and, of course, the issue of vaccine hesitancy.
Yes, no, it's been difficult. We've all seen the spike of insecurity continue to be a thing in Nigeria. So I will admit that, this hasn't been a walk in the park for getting all these vaccine drives in. In fact, in the campaigns in October, the one downside was that there were states where we just weren't able to access, right, because they were security compromised, right? States like Sokoto, Zamfara, Borno, for obvious reasons. So that continues to be a challenge, and the way we want to approach is just working closely with the government and the security apparatus on ground to find windows where we can go in and be able to get these kids and give them what they want, or just wait till this insecurity dies down in that area, but be ready to actually go in and be able to give these life-saving vaccines. So I think that's work that we need to continue doing more intentionally. I think the second question you had was around the funds that are reducing.
No, I talked about vaccine hesitancy.
Oh, hesitancy, yes. So it's the vaccine hesitancy is something that is real, right? I think, for different reasons, people have different levels of hesitancy to this. I think there are two ways we have tried and continue to try to address this, right? One is being able to explain to people the benefits of vaccines in terms of being able to protect their children, and being able to put data in front of people, evidence around the efficacy and the safety of this type of vaccines. So that's one way to do it, and actually demonstrate where other countries have been able to, have been able to use these vaccines to be able to, give their children a chance to be able to live to the age of 5 and survive. Nigeria is one of the youngest populations in the world, and if we are not able to harness that population into productive activity, because you're losing a lot of children before the age of 5, that is, the demographic dividend that will never be a reality for us. But the second part is also talking to people in the community that are actually that are actually can help us talk about these things in a way that resonates with the people we are trying to reach. So people of influence, right? So whether it's your religious leaders or your traditional leaders, or or people within your community that can talk about the experience in being able to address, in being able to show that vaccines are actually a safe and reliable means for people to be able to protect their kids. So this dual purpose of relying on evidence of what works, but also breaking things down in a way that the average man understands, can ask their questions, and have trusted people help them interpret their fears and concerns, is a dual path that we've used before, and we hope to continue using that to work. The last piece, actually, I'll add a third piece if you don't mind me, is actually the media. The people trust the media, right? And part of the reason why we're here today is to put some of these things out there and rely on the media to be able to help us bring some of this reality to the people, either through jingles or radio programs or programs like this. So, I will also challenge you, Cynthia, to also be an advocate for things like this, because we know that it's ultimately for the betterment of the country, for us to be able to, protect ourselves and our children against vaccine-preventable diseases.
Well, even though you called us out, this was a very insightful, insightful discussion, and we'd like to thank you for the good work you're doing, and we wish you well in all that you're pursuing in 2026. Mr. Uche Amaonwu, Bill and Melinda Gates Foundation Chief Executive in Nigeria, thank you so much for joining us here on Newsday.